to the Swiss Liver Patients Association, Swiss HIPAA. Today with the presentation by PD Dr. Christoph Jüngst, Senior Physician at the Clinic for Gastroenterology and Hepatology at the University Hospital Zurich, with the topic Liver Toxicity by Mushroom Intoxication. Welcome, Dr. Jüngst.
To give a talk on liver toxicity by mushroom intoxication. The most important mushroom which is involved in liver toxicity is the death cap or Amanita phalloides or other amatoxin containing mushrooms. These mushrooms are very poisoning with a lethality of about 50 to 20% in adults and up to 50% in children. About 90% of all deaths caused by mushroom intoxication are because of the death cap. In Switzerland, there are reported up to 8 fatal cases a year due to intoxication with the death cap. There are 2 different toxins which the death cap contains. One is phallotoxins. These directly injure the intestinal cellular membrane, causing vomiting, nausea, and diarrhea. But the phallotoxins are not resorbed, therefore they don't cause any liver injury. The amatoxin is resorbed via the intestinal membrane. It's transported to the liver, taken up in the hepatocyte, and in the hepatocyte it blocks the RNA polymerase II and thereby protein synthesis, leading to apoptosis and cell necrosis. About 60% of the amatoxin is eliminated via the biliary tract, then enters the enterohepatic circulation, is retransported to the liver and taken up again. The lethal doses is as low as 0.1 milligram per kilogram body weight, which can be contained in one single mushroom. The clinical course shows 3 different phases. The first phase is the phase of latency. Patients don't have any symptoms. This lasts about 6 to 15 hours, rarely up to 24 hours after ingestion of the mushroom. Then the next phase is the gastrointestinal phase after about 6 to 15 hours after ingestion. It starts with vomiting, really severe, potentially bloody diarrhea, which lead to dehydration and disturbance of electrolytes. Then the next phase, starting about 24 to 48 hours, is the hepatorenal phase. The patient initially even feels a bit better, but transaminases are rising dramatically. The patient is progressively injured and developing acute liver failure with hepatic encephalopathy and also kidney failure. There's a rule of thumb: after mushroom ingestion with symptoms, and the symptoms arise shortly after ingestion, mostly after 4 hours. This is more likely a benign cause, like a benign gastroenteritis. If the latency is longer, 4 to 6 hours, this is more likely a severe mushroom poisoning. There are exceptions. For example, if different mushrooms are taken, then you can have an early gastroenteritis symptoms, but in addition have the intoxication by the death cap. What should we do if we have symptoms after mushroom ingestion? When you have really severe symptoms, then call the ambulance 144. They will bring you to the next emergency department. If the symptoms are mild and you're not sure if it's really getting worse or you're unsecure about your symptoms, you can call a 24/7 hotline of Tox Info Suisse 145. to ask for further advice. You should keep leftovers and vomit to allow identification of the mushroom later. If you are unsecure after collecting mushrooms, you have the option to show them at some specific mushroom control points. There is even a website where you can check the next mushroom control point in your area, and you can go there with your collected mushrooms and show them to these professionals. The intoxication with the death cap is diagnosed by detecting amatoxin in urine, which is possible as early as 6 hours after ingestion of the mushroom, up to 60 hours. The therapy should be initiated as early as possible because of the high lethality and toxicity of this mushroom. The therapy should even be started when the diagnosis is not clearly stated and can then be terminated if amatoxin in urine is negative or transaminases are normal. And it's very important that also asymptomatic persons, which also took these mushrooms, that they get also hospitalized and tested if they have intoxication by amatoxin. What can we do if patients have these intoxications by the death cap? The first is decontamination via activated charcoal repeatedly. Thereby we eliminate the amatoxin from the enterohepatic circulation. Then it is very important to give an antidote, the silibinin, intravenously very early in the disease course. Thereby you will block the uptake of the amatoxin in the liver cells and also interrupt the enterohepatic circulation. And this should really be initiated as early as possible, and don't wait for the lab results where the amatoxin in urine might be positive then later. In addition, you can give N-acetylcysteine intravenously, like in paracetamol intoxication, as an add-on. Most of the patients will be treated on an intensive care unit, rehydrated, and electrolyte disturbances will be corrected. In the case of acute kidney injury, hemodialysis will be initiated, and it's also very important that the doctors contact a center which has the capacity of liver transplantation. And in the case of progressive liver injury, liver transplantation is the final option. There are some prognostic criteria of acute liver injury which can be used to decide if liver transplantation is necessary. There are some worse signs, for example, a short asymptomatic phase of latency, when the therapy is initiated rather late, when we find a low, quick or high INR, and in very young patients. In conclusion, the death cap is a very toxic mushroom. We have 3 clinical phases of death cap intoxication. We have the latency phase at the beginning without symptoms, then the gastrointestinal phase with severe bloody diarrhea, and then the hepatorenal phase with liver and kidney failure. In the case of intoxication, contact the ambulance. They will bring you to the emergency department, or when you have less severe symptoms, you can contact Tox Info Suisse for further advice. Keep leftovers, vomits, to allow identification of the mushroom later. The therapy should be initiated as early as possible with activated charcoal, and the antidote is silibinin. All persons which also took part in the mushroom dinner should be hospitalized and should be tested for intoxication. And if you're insecure of your mushrooms after collecting them, you can contact some mushroom control points in your area. Thank you very much for your attention.
Thank you very much for the informative and exciting presentation by Dr. Jüngst and your great personal commitment. Thank you very much.